Hello friends, my name is Preeti. I'm a registered nurse and in today's topic I created a short video to understand what is ABG. So without any wasting any time, let's get started. So ABG stands for arterial blood gases. Arterial blood gases are simply the measurement of whether the blood is acidic or alkaline. When we do the blood test, this is the arterial blood gases. So the blood test has been taken from the artery. Most of the time it's taken from the radial artery. What we are checking in the blood gases. And that four components that are very important when we are doing acid base imbalance. So the first one we have a pH, then is PaCO2, that is the concentration of carbon dioxide in the blood. Bicarbonate, that is HCO3, the concentration of bicarbonate in the blood. And PaO2, that gives an idea of oxygen in the blood. So we're going to go over each one by one. So number one, we have pH. The normal value for pH is 7.35 to 7.45. pH will give you an idea whether the blood is acidic or alkaline. pH is regulated by both the lungs and the kidney. The lungs and the kidney, they both work hand in hand to maintain the equilibrium of pH in the blood to keep the pH in the normal range, which is 7.35 to 7.45. The second component we have is PaCO2, which is the carbon dioxide, the concentration of carbon dioxide in the arterial blood. The normal value for carbon dioxide is 35 to 45. And carbon dioxide is regulated by lungs. When we are thinking about carbon dioxide, think about acid. The more carbon dioxide the patient has in their blood, the more acidic the blood is. This will help you when we're going to do the acid base analysis. Third component we have is bicarbonate. The normal value for bicarbonate is 22 to 26. Think about base whenever you look at the value of bicarbonate. And bicarbonate is regulated by kidney. For the carbon dioxide, earlier I told you when you look at the value, think about acid. More carbon dioxide in the blood, more acidic the blood is. More bicarbonate present in the blood, more basic means more alkaline the blood is. Last but not least, PaO2, which is the oxygen. The normal value is 80 to 100 and which is regulated by lungs. Now, when we are working with acid base analysis or interpretation, the value we look at is pH, PaCO2, and HCO3. We don't usually look at PaO2, but the number of PaO2 will give us an idea whether the patient is having hypoxemia or no. In the next video, we're gonna go over the 3 steps of acid-base analysis. But in order to do that, I want you guys to understand what is pH, what is carbon dioxide, and what is bicarbonate, and the normal value of that. Trust me, guys, if you memorize the normal value, if you know them, you will gonna breeze the acid-base analysis. Thank you for watching, and I'll see you guys in the next video. Bye bye.